Hello everyone. For those of you new to this channel, my name is Laura. I was diagnosed with triple negative breast cancer on October 15, 2025. I went through the Keynote 522 protocol for treating triple negative breast cancer. My last treatment for that was April 29th. I shopped around for a surgical breast oncologist and landed at University of Michigan in Ann Arbor. And through her recommendation, I had surgery on June 4th. It was a lumpectomy with a targeted axillary dissection. So in my previous videos, I had described that going into surgery, I was either going to have the short version or the long version. And I woke up after surgery with the short version. I was extremely happy. They removed 5 lymph nodes from my right armpit, axilla. And while I was still under, they did, I think it's called a freeze slide to check for living cancer. Okay, guys, come on. And none was detected. Actually, this way, come on. None was detected. So they they closed up my incision in my axilla, and they proceeded to do the lumpectomy. 2 weeks later, pathology came back, and I had achieved PCR, which is pathologic complete response. It is the best pathology that you can get. That was the gold that I was striving for, and I achieved it. So I was very, very happy. So with the lumpectomy and the tumor bed, it was just basically fibrotic tissue that they had removed. And there was clear margins all around. And of the 5 lymph nodes, we knew one for sure had cancer because it was biopsied. So that one tested negative, obviously. 2 other lymph nodes, which ultimately tested negative, they showed signs of treatment. So there was cancer in 2 other lymph nodes, and it didn't show up on MRI or CT. So just a note to show you, whoever else is going through this. Testing is really good, but it's not 100% fail-safe. It doesn't always pick up. I never had a PET scan because through insurance, lovely insurance, they had deemed that the MRI was good enough and there was no need for a PET scan. Had I had a PET scan, would those other lymph nodes have shown up? I don't know. Maybe, maybe not. But, so I'm not trying to discourage people with testing. I'm just trying to educate people that it's not a 100% for sure type of thing. The only thing for sure, absolute, is your pathology after surgery. That is the ultimate right there. See? Lovely Michigan beach morning. Woohoo! So, and then so that was 3 lymph nodes. The remaining other 2, they did not show signs of treatment, and they obviously tested negative as well. So I was good to go. There was no need to go further and remove more lymph nodes. So after surgery, It was an outpatient procedure. I stayed with some friends in Ann Arbor. I got discharged with wearing a breast binder. It's just like this little tube top. It's to help keep seromas, which are pockets of fluid, from forming, not only in your axilla, but your breast as well. So far, so good. I was only supposed to wear it for 2 weeks. I'm still wearing it. Just want to make sure. So now I'm shopping for a radiation oncologist because lumpectomy is just as effective for minimizing recurrence as mastectomy when you pair it with radiation. You have to have whole breast radiation. It's not really something advisable to bypass. If I were to not have whole breast radiation right now, I think my numbers could be off, but just to give you an idea, my percentage of recurrence would be 25 to 30%. And when you add radiation into the mix, like whole breast radiation, your percentage drops down to about 3 to 5%. So, and with triple negative and its aggressive nature, you really want to do that. Me, I've come this far. I've had excellent results thus far, so I really don't want to screw it up. What else? I did have my telehealth with a Dr. Stephen Goebel Allen, affiliated with U of M. I had that last week. He initially said 4 weeks of radiation treatment, 3 weeks of just the normal standard treatment, and then the 4th week would be the boost, which is a targeted treatment to where the tumor bed was located. And I kind of hemmed and hawed and pushed and prodded him a little bit, and then he finally acquiesced and said, considering my pathology, he could still feel comfortable with a 3-week hypofractionated irradiation, whole breast irradiation, in conjunction with the targeted boost. So basically, in layman's terms, they would take that 4th week where the boost is, and they would sprinkle it in randomly throughout the 3 weeks. So that way, all said and done, my treatment would be 3 weeks long, which is more to my liking. He also said that they start treatments as early as 7 a.m. in the morning, so they would be willing to work with me. Like I could get a 7 a.m. treatment on Friday, and then my treatment on Monday could be the latest time in the afternoon, which I'm assuming is around 3, 4, or 5. So that gives me the largest window for me to travel back home and see the puppers, who are right there, and help Mark, my husband, out with the farm and blah blah blah. Now this coming Wednesday, I have another telehealth appointment with Dr. Kaufman, who out of McLaren, which is located in Petoskey. And I saw him initially in February. When I saw him in February, I was still on chemo, so we did not have the results of chemo. I had not had surgery yet, and he, right off the bat, was recommending 5 to 6 weeks of treatment, or at least he was preparing me that that's the amount of treatment I would need. So I'm still going to keep this telehealth appointment with him because I would like to see what he has to say now. I'm still leaning towards U of M just because they're a larger academic facility. They're a little bit more up to date on current research and trends. And especially with breast cancer, new things are popping up daily. So I'm not trying to say that Dr. Kaufman or McLaren is bad. It's not bad. I just know I've really fought to get through this to the best of my ability. And I'm on the last leg of this treatment journey, and I just don't want to screw it up. And if I think the best option is going through University of Michigan in Ann Arbor, then I'm leaning in that direction. I have to have the decision made by July 10th because they like to start radiation close to like 4 to 6 weeks out from surgery. So I'm probably looking at, to initially start radiation, you have to have a mapping. So basically, and this is what I've read, so maybe things have changed since what I've read, but what they'll do is lay you down on a table in the machine, and they got to pinpoint exactly where this radiation is going. So I think you get like 3 little dots, like tattoos, so that way the machine can pinpoint exactly. And you have to be in the same position, the same time every day, because you're getting treatment Monday through Friday. And it's very high tech. Physicists are involved with your doctors, and you're going to have multiple doctors, especially at U of M. It's multiple doctors peer reviewing everything. It's calculated down to the millimeter, so it's pretty high tech. And so I would have to go down for a mapping, and then I think the bulk of the treatment would be in August. Like late July would be possibly the start, and then through August. So, I don't know, we'll see. That's where I am at right now. I also have, with Keynote 522, I have the standalone Keytruda infusions. They have not started yet. I also have a telehealth this coming Wednesday with my oncologist. And there's a possibility I am a candidate for a trial that's going on right now called Optum Ice. It's a plane. And Optum Ice is studying, they know now immunotherapy paired with certain types of chemo is extremely effective for triple-negative breast cancer. So now they want to study de-escalation. Like, where's that sweet spot of the most effective treatment, but yet not too much treatment? Because, you don't want to keep hitting your body with immunotherapy. You'll start having problems, whatnot. And for me in particular, I've done very well with the immunotherapy. I have not had the side effects that most people not, I shouldn't say most people, some people can get. The two most important side effects to me are my thyroid and my adrenal glands. My thyroid is working great. I don't want that to be messed up. I know if it were to get messed up, I could be on Synthroid for the rest of my life, which is just a simple little pill, but you know, you got to calibrate that, and I'm just not really into that. I don't really want to take a pill every day. I know it's not the end of the world if I had to, but I just don't want to. I mean, if it's working correctly now, like they say, if it's not broke, don't fix it. So, sorry, got to go around this tree. So I'm trying to decide about these standalone immunotherapy treatments. I'm inclined at the moment to go with it, and still, because the oncologist did say, he goes, well, instead of every 3 weeks, we could go every 6 weeks. You'd still get the same amount of immunotherapy, but it would just be over a 6-week period versus 3 weeks. The only reason why I do not like that option is I want my labs done every 3 weeks. I want to keep a really close eye on my thyroid and my adrenals and see what's going on. Because if problems are starting to occur, I might just opt out of the rest of the immunotherapy. But haven't decided that yet. Big decisions. Sit. Good boys. Toby, sit. Hey. Good boy. Look at them good dogs. Okay. So that's where I'm at. That's what I'm thinking about. I encourage anyone, even if it's not breast cancer, whatever cancer, I encourage everyone to read and educate yourself as much as possible. Unfortunately, in this day and age, a lot of the information that you're going to come across can be bad. So you have to wear your boots and sift through the crap, so to speak. But you're the only one that lives your life. You're the only one that knows how you feel with the symptoms that come from treatment. So you're the only one that can make these decisions ultimately. And the best way to make those decisions is by educating yourself. I'm trying to think if there's anything else I need to say on this. And if there's anything that somebody knows more than me that I'm not thinking about, tell me. Comment. I am not an expert on this at all. I'm just trying to educate myself to the best of my ability. So I'm open for suggestions, people. And if you have any suggestions on whether I should stay local or go to U of M, I'm willing to hear those as well. Right now, because I have the bulk of July kind of free, I'm doing my best to get the farm, homestead up and running, and we're really, really behind on everything. So it's this lovely game of catch up. So that's what my time has been consuming me of. And a reason why I have not filmed this update in a prompt fashion. But probably next week or this coming week, after I've had all my telehealth appointments, I really should have my decision made after the 4th of July, just so we can get this ball rolling. So, thanks for listening. Hope you enjoyed it. And it's a gorgeous day. Have fun. Bye.